you guys. Thank you so much for coming to my sleepover. I really appreciate it.
It's cool. No problem. I mean, so what are we gonna do? We're not just gonna stay here.
You guys want to play a board game?
No, that's too boring. Let's just watch this new show that I found on Netflix.
What's
I
it
think
called?
I might like it. Grey's Anatomy. It's about like doctors and the body and stuff. So
Sounds interesting.
they have Dr. McDreamy, so
Ooh, interesting.
let's just start watching it.
Hi, I'm Dr. Jones. How are you today?
Good. I'm Dolores Hingle.
What brings you here today?
Well, I've had pains all over my body. I don't really know why.
When did they start?
Well, they started about a week ago.
About a week ago. So what are you doing?
I had just finished gardening and it started.
How often do you garden?
Almost every day. Gotta keep my plants alive.
That's great. So you're very active.
Very.
So let's start with looking at your chart. I'm gonna ask you a couple questions about your family. Or is there a history of diseases in your family?
Well, before my mother died, she had arthritis.
Arthritis?
That's about it.
Oh, so you don't even know anything about your other family members or what they may or may not have had?
No, not really.
Okay, I'm gonna look at your chart here, and I'm gonna see the notes that your last doctor took. He tested you for scoliosis. Do you know what that is?
No, not really.
These doctors, they never explain to the patient really what's going on. The scoliosis, so there's non-structural scoliosis, which is when the spine appears to be curved and it's caused by another defect in the body. And once that defect is cured or taken care of, then the spine will straighten itself out. And then there's structural scoliosis, when the spine curves irregularly, but you can't really fix that by just with medication. Some people do take surgeries to perfect the procedure, but you know, it's very invasive, it's very dangerous, so most people don't do it. Have you been having any pains in your spine?
No.
No? Okay, that's good. Let's look more at your chart. You also had been tested for cardiomyopathy. Did they talk to you about it?
No,
About that
you can
either?
really explain.
Have you been feeling any chest pain?
No.
Well, in cardiomyopathy, there's 3 different types, which is dilated, hypertrophic, and stress-induced. Stress-induced is the type where you are experiencing very emotional pain or traumatic pain from possibly a natural disaster, and it really affects the way your heart pumps blood. And it affects the valves and different things in your hearts. And these can be cured with like basically drugs, implanted devices, or sometimes if it's very severe, it can be cured with a heart transplant, but that's in the most severe cases. Let's look at your chart. Oh, another thing that they tested you for here, as I'm looking, is osteoporosis. Have you been having any issues with feeling very fragile, losing weight rapidly?
No, I've been fine.
Fine? Okay. Well, osteoporosis is when the tissues in the bone, the holes in the bone, they begin to get larger and they're not supposed to. It's supposed to be regular size. And if you look here on the monitor, there's a couple different pictures of things that I've mentioned, just so you can see what it really looks like. Osteoporosis it can be cured with different drugs. Another thing that people usually do when a patient has this, they change the diet, they exercise more, they use weights so that you can increase the bone mass and get back to your regular self. So osteoporosis is when like the bones become very fragile and very brittle. That means if you're gardening or taking care of your plants, you can easily hurt yourself, and we don't want that.
No, I sure hope I don't have that one.
Yeah, I'm waiting on the x-rays I put in earlier for your x-ray, and the nurse should be in soon to give me those x-rays. They should be here in about a couple seconds.
Should be knocking at the door.
Oh, is that you? Thank you so much. So this is an x-ray of your leg bone. We took an x-ray of your whole body with the nurse, and it's come back, and it looks like you have arthritic knee joint. Do you know what that is? So that means when that decreases, they're rubbing up against each other, and that causes a pain, you know? it's not really good. You have to get that checked out. We're gonna get you going. So let's look at your charts to see if you're taking your medications before I prescribe anything for you. It looks like you don't really have any allergies. So what's gonna happen is, let's take a look here. I'm gonna prescribe some anti-inflammatory drugs and some pain medication. I really think that should help you because arthritis, it can be mild, it can be moderate, it can be extremely painful. And since we caught it early, we don't want it to persist. You want the cartilage in between the bones to get healthier so that you can live a happy life.
Well, thank you. I appreciate your help today.
I'm glad I could help. Good afternoon, everybody. I hope you're having a fantastic day. Today I have Dr. Robinson, who's a rheumatologist, and later on I'm going to have Dr. Hendricks, who's an orthopedic surgeon. So how are you?
I'm doing fine, but considering the state of many Americans, it's kind of hard for me to find a situation humorous. But in all seriousness, millions of Americans today are struggling health-wise with their bodies, and I just want to teach them better ways to help themselves, and it'll help my job be a little bit easier.
I agree, Dr. Robinson. All I know is that it takes more muscles to frown than to smile, but what can we do to stop these healthy habits? Before we can discuss how to do this, what if the people that are watching this don't understand what these systems are?
Okay, so I'm a rheumatologist, so I specialize in the muscular system, and the muscular system is used every day. It's extremely important, and its main function is movement. So in your body, there are 3 types of muscles, 2 of which are involuntary and 1 of which is voluntary. The skeletal muscles, which are connected through tendons, and when the muscle contracts, it pulls on the tendons and it moves the bone. And because you can control these muscles for things like movement or even posture, it is a voluntary muscle. Whereas you have 2 involuntary muscles, which are the smooth and the cardiac muscle. The cardiac muscle, obviously, is used for your heart, and it's located in your heart where they pump blood throughout your body and changes the speed to better suit your environment. So, for example, your heartbeat is different compared to when you're laying down, compared to when you're out playing sports. Whereas the smooth muscles are all found throughout the body and are extremely crucial to its everyday functions. Because those type of muscles are found all throughout your body. It is used for many different things. For example, the uterus is used to push a baby out. Not only that, but there's also smooth muscles help push sperm through the reproductive tract, and it also helps regulate airflow in the lungs and a multitude of other things that are really useful in the body. So do you guys kind of understand the importance of muscles in everyday life? And
wow, now that we know the importance of the muscular system, what can we do to stay in the best shape?
The main thing would be to exercise. Muscles aren't able to just move by themselves. It requires work. Each muscle is surrounded by a connective sheath called the epithelium, and there's also a fascia, connective tissue outside the epithelium surrounds and that separates the muscles. Portions of the epithelium project inward to divide the muscles into compartments, and each compartment contains a bundle of muscle fibers, and each bundle of muscle fibers is called the fasciculus, and it's surrounded by a layer of connective tissue called the paramecium. Within the fasciculus, each individual muscle cell called the muscle fiber is surrounded by a connective tissue called the endomysium.
Wow, thanks for the insight, Dr. Robinson. Now that we know everything about the muscular system, what about the skeletal system, Dr. Hendricks?
Dolphins, they have a skeletal structure similar to humans' arms and hands. Like us, dolphins have a rib cage, but theirs is adjustable so that they can swim in low-pressure environments without sustaining injuries. Seeing as how we continue to destroy their environments by polluting them without as much of a care as to how much we're altering their lifestyles, I don't know if you know, but not all trash stays on the surface of water. Some sinks, which could cause injuries to dolphins and other organisms more than it already does if we keep it up. Horses also have cardiac, skeletal, and smooth muscles that all function pretty much the same as our muscular system. Dogs, on average, have 319 bones, at least 100 more than we have. Despite the fact that their bones are stronger, they are very fragile-minded animals that connect with humans on an emotional level. Humans often take this connection for granted, abusing and using the animals to their benefit, but we should probably stop that too. We should be treating them better and raising more awareness for their mistreatment. Keep in mind that if animals can become endangered, don't you think we can too? We're not exactly exempt. I mean, come on, we are animals. All right, that's all for today, folks. Back to you guys. Dr. Jones.
Thank you so much, Split. That commercial is very informative, and I really appreciate you bringing to my attention and to the viewers' attention that it's important to understand how your human impact has an impact on the environment. So, Dr. Hendricks, what brings you here today?
Well, I'm an orthopedic surgeon, and I'm basically here to talk about the skeletal system and its main functions and how important it is to take care of your body. The main function of the skeletal system is support, movement, protection, and blood cell production. As you can see here, there are 206 bones in the body. The exoskeleton includes bones that run along the medial sagittal plane of the body. Imagine a vertical plane that runs through your body from front to back and divides the body into equal right and left regions. This is the medial sagittal plane. The exoskeleton forms a central axis that includes bones of the skull, hyoid, vertebral column, and thoracic cage. The exoskeleton protects numerous vital organs and soft tissues of the body. The skull provides protection for the brain, the vertebral column protects the spinal cord, and the thoracic cage protects the heart and lungs.
Wow.
The exoskeleton, skull, includes bones of the cranium, face, and ears. Hyoid is a U-shaped bone or complex bones in between the chin and larynx. The vertebral column includes the spinal vertebrae, and the thoracic cage includes ribs and sternum, which is the breastbone. The appendicular skeleton is composed of body limbs and structures that attach limbs to the exoskeleton. Bones of the upper and lower limbs, pectoral girdles, and pelvic girdles are components of this skeleton. Although the primary function of the appendicular skeleton is for bodily movement, it also provides protection for organs of the digestive system, excretory system, and the reproductive system. The appendicular skeleton, pectoral girdle, includes shoulder bones, upper limbs includes bones of the arms and hands. Pelvic girdle includes hip bones, the lower limbs includes bones of the legs and feet.
Wow, our skeletal system is extremely complex. What can we do to make sure we have strong bones?
Well, make sure you eat healthy and take your vitamins. Most importantly, exercise. Know your limits. If your body says stop, stop.
Wow, thank you so much, Dr. Hendricks. And I also want to thank Dr. Brianna Robinson for her information given earlier. So would you guys want to join me for a game of Jeopardy?
Of course.
That's great. Okay. Well, viewers, see you next time.
The skull protects the brain, the spine protects the spinal cord, and the rib cage protects the heart and lungs.
That's correct. For 700, what is the functionality of the hinge joint?
The hinge joint is formed by two or so bones where they can only move on one axis and they flex and extend in the body.
Correct. For 800, how does the ball and socket joint function?
The ball and socket joint in a rounded surface of a bone moves within and around other bones. These types of areas of the hips and the shoulder.
Correct. For 900, how does the pivot joint work?
A pivot is an area like to bone in your neck or the radius and ulna. The bone rotates in a ring formed by a second bone and a ligament. It is a freely movable joint that rotates on an axis.
Correct. You guys are so brilliant. For 1,000, give one example of each type of joint from the previous questions.
A hinge joint is an ankle, a pivot joint is the neck bone, and the ball and socket joint is a shoulder.
Correct! You won again, Chanel. See you guys next time. Wow, that was a really great show.
I told y'all.
I think I want to be a doctor now.
I learned so much. It was great.
Now I know to take care of my body.
Take care of y'all body too.
I just want to go home.
I got that. Okay.
Chop it.
Game time.
Screen, it went dark. Touch the screen, it went dark. We're gonna keep it going. You sit up. I think y'all need to lose the chairs.
What we gonna
What we gonna do? Crouch?
I can do it online. That's
working together. Blooper reel.
Shut up.